Did you know that 1 in 5 GP appointments are for loneliness or debt or other non-medical issues? And that despite there being thousands of community-based organisations such as Age UK or Citizens Advice that can help, most people never get support. And that traditional methods of referring people to services can result in a 10% attendance rate. This is why I started Joy, to fundamentally transform the way that people access those amazing community-based services. We provide a digital referral pathway which enables anyone and everyone to make a referral to a community-based service. The average attendance rate for a Joy referral is 80%, 8 times better than those traditional methods. I think this is amazing and has the potential to change millions of people's lives, but I'm biased. It's my idea. I would say that, wouldn't I? So we asked a few of our users to tell us what they thought about Joy, and this is what they said.
My name's Amanda Cracknell and I'm a social prescriber working across 2 GP practices. What makes Joy a real asset to the role that I do is the quick and efficient way that I can search for community services based on what matters to the client that I'm working with, and directly refer them onto that service all in a matter of a few minutes. It also lets me follow that referral, something which I couldn't really easily do before Joy, and therefore offer some timely support to that client if there's a barrier to them accessing the service for the first time. I do think Joy is an absolutely fantastic app, certainly for social prescribers, and I'm looking forward to seeing how it develops in the future.
My name's Amy, I'm a caseworker for an MP. I spend most of my time supporting our constituents through a whole range of issues and often through a crisis. When lockdown was first introduced, Joy was an absolute lifesaver. First of all, we'd use Joy to find the local services available in the area, something which was impossible for us to do by ourselves. Second of all, we use Joy to refer constituents directly to the service. And third of all, Joy keeps us updated on the constituents' progress. It tells us if they've attended the service, how they're doing, so we can rest assured that they're getting the support that they need. So Joy has saved us a lot of time. It's a really valuable and useful tool in our office, and I'm really looking forward to continue using it in the future.
Hi, my name is Mustafa Kamara. I'm a senior public health practitioner in the local authority of Wokingham. We commissioned the development of the Joy platform to help solve some of our biggest challenges with the way that we reduce inequalities in health and social well-being among our residents. And already we've seen some of our residents use the platform to make faster and more meaningful connections with our local services in a time where local resource has become particularly stretched as a result of the pandemic. Another aspect of the platform that we're really impressed with is the way that it collects and manages data in real time. And this is really useful for us because it gives us insights, valuable understanding as to where the needs are and where issues are likely to emerge in the future. So Joy is being developed to help us do that. It's going to help inform lots of the work that we do around strategy and commissioning to help our services ultimately be more responsive to the needs of our vulnerable residents.
Hello, I'm Fiona Price. I'm the Chief Executive of Age UK Berkshire. We're a Berkshire-based charity that supports around 18,000 older people a year. One of the main concerns we have, and we have had for many years, is around loneliness and social isolation. So we've been using the Joy app for a couple of months now to make sure that the older people that we work with can access the help and the support that they need. The app is easy to use, it's straightforward and it's simple, and it helps us greatly. Thank you.
Using Joy is really straightforward. It has a clear interface and I find it so easy to be able to check what services and activities are available in a particular area. It's really streamlined my processes because I can check all of the referrals I've made in one place, and when somebody refers to my service I get an email and all I have to do is click on the accept button.
So far, Joy has facilitated 400 referrals, which is a great start. But we want to help more people. And to do that, we need to partner with CCGs and local authorities, with people who care about what we care about. So if that's you, all you need to do is send an email saying, I'm interested, and we can make it happen.